Hi, I'm Kim Hoh. In this series, we'll be talking to people who have interesting, inspiring, or intriguing stories to tell. This week, we meet Eng Aik Meng, head honcho of TE Asia Healthcare. A classic case of a small-town boy made good, Aik Meng owes his success to a combination of smart, hard work, a willingness to take risks, and being contrarian. He started his career in shipping and rose to become president of APL, one of the world's biggest companies in marine and shipping containers. However, he shocked the corporate world by leaving the industry to go into healthcare. A turning point came when he had to care for his mother when she was diagnosed with cancer. He saw firsthand how she had to run from pillar to post for different cancer subspecialties and decided there was a need for integrated care. Since 2015, TE Asia Healthcare has invested more than US $250 million in specialty centers and integrated healthcare facilities throughout Asia. This is his story.
If you're thinking about something else to do, you've got to find something that really means something to you, that can ignite a passion in you to say that even on a weekend or even on holiday, I'm willing to do something like this, to try to understand what's behind it so I can make it successful. By then, I had been working for close to 20 years. And most of it had been in the shipping industry. And I had always wondered what it's like doing something different. I was about, in my early 40s, and I decided that if I don't do it now, I'm probably never going to do it. And I would always wonder at the back of my mind, what if I tried something different? I was quite clear that, I wanted something different, but I knew that my strength was in Asia, Southeast Asia in particular. I knew that I liked working with people, so I was trying to find something that kind of gels together. And of course, you also want to do something that has a meaningful impact on society. So healthcare came along. I was approached by a healthcare group, Fortis Healthcare. They wanted to expand in Southeast Asia. And I said, I'm going to try it. I'm going to do that, right? So that was my entry into healthcare. When I heard that news, it was heartbreaking. Well, one, because she didn't tell me earlier. Two, I also felt quite lost because although I had been in healthcare, the shock of it when it happens to a loved one is very different. I would try to accompany her for her chemo visits, to her doctor visits and all. And you see things from a very different lens, right? Some small things that you would not have thought about if you were a CEO of a company, right? And you start to ask questions, could this be done better? Why does the patient have to go through this? Why does the caregiver have to deal with that? One of the things she really hated was going to the hospital. And most of these treatments were done in the hospital. I still remember there were a few occasions where she actually told me she wanted to give up treatment. I started thinking, why can't some of these things be done in a standalone center? So that's where I started exploring and thinking about, could we set up centers like that? The initial part, I think, was tough. Was simple things. I didn't even know how to set up a phone line. I had many heart-stopping moments, right? I was wondering even, are we going to survive month after month? But it worked. We grew from 3, we're now close to 30 people. We are in 7 countries. We probably have about 12, 13 centers across those countries. And we continue to believe in this thesis. Specialty healthcare recruiting good doctors, and what we believe is delivering good care to patients.